Hi, everyone. Jonathan Brandt with GoOutLiving. We have a special guest on today. We have Dr. Edward Feinberg, dentist and currently director of Onward. And I was hoping, one, I'm really happy for you to be here. So thank you for coming on. Why don't you explain Onward, and then we'll move into kind of where you came from.
Okay, well, Onward really is an outgrowth of where I came from. So I have a very unusual path in dentistry. I grew up in dentistry, and my father was a master and pioneer of full mouth reconstruction and crown and bridge dentistry. And I was trained completely differently from everyone else. My dad started the Westchester Academy of Restorative Dentistry, and we used to give courses in the office to dentists where we would take a patient, and in like 7 Wednesday mornings, we would show every step how to make a fixed bridge, and another 7 sessions how to make a precision attachment case. And then from after my dad passed away, the world changed. And a lot of dentists didn't want to go to meetings. And so we converted this into an online organization. So it's the Online World Academy of Restorative Dentistry, or the onwardprogram.com. And the point was to make sure that all this information is passed on to whoever wants to learn it. Because what I'm seeing is a lot of dentists are having difficulty with problems that were actually solved in the 1930s. And that's really sad when you think about it, because real dentistry is about basic principles. And the basic principles that came from dentistry's roots are systematically violated by all the techniques that they are teaching in the dental schools. And most dentists have no idea, but they have no confidence in their crown and bridge skills. And that is one of the reasons why there's an absolute epidemic of tooth extraction and implant placement. And many of those teeth are teeth that can easily be saved, but they can't be saved with the techniques that are currently being taught. And that is a really big problem in my mind. And it's very hard to get people to understand this and be interested in it when they've been indoctrinated into a certain way of thinking. And it's really upsetting to me the direction that things are going, or that have been going in over the course of my career.
Well, and we kind of see that with all medical right now, don't we? But here's my thing, and why I really thought this was important for everybody is we ignore. We don't like going to the dentist. We ignore our teeth. I mean, that's just straightforward. So then on top of it, you also have dentists not doing, in your mind, the right thing as well, because they're not being taught the right thing. So it's this combination that is really, honestly, it becomes devastating, doesn't it?
Yes, in dentistry, everything is prevention, and people don't understand that. The way people get into trouble with losing their teeth is not so much from decay, but from periodontal bone loss. And when I talk about the bone loss, I'm talking about the bone specifically around the roots. The roots are connected to the bone by a ligament called the periodontal ligament. And when bone disappears, we don't know how to grow it back. So everything that we do in dentistry is geared toward preventing the bone from being lost. So now there are factors that we don't have any control over that contribute to bone loss, and there are factors that we do have control over. And the factors that we don't have control over are things like genetics, um, growth and development problems. But a lot of those can be changed and fixed. A lot of those, and that's why there's a field of orthodontics to reposition the teeth in the right place so that they take forces in the right directions. But the number one cause of bone loss is letting tartar and plaque and calculus build up, because that can cause the gums to become inflamed, and that can spread to the underlying bone. So the single best thing that anybody can do for their oral health is to have regular hygiene with their dentist and diligent home care at home, because it removes that one factor that we know contributes to bone loss. Another cause would be missing teeth. And what happens is, it tends to happen is that teeth around spaces drift into the spaces, and teeth opposite the spaces erupt into the spaces. And then the teeth start taking forces in abnormal directions. And nobody knows at what point the body's not going to tolerate that. And when the body can't tolerate that, one of two things happens: either the bone goes or the teeth wear. And those are the two things that go wrong with human beings. And that's why it's so important to replace missing teeth. Other things that can cause bone loss are things like food impaction areas that can melt the bone faster than anything else. So you don't want to have areas where food gets caught in between teeth, because that can do irreversible damage. And the thing that's great about Crown and Bridge is that it's corrective, so that you are changing the architecture and bringing the forces up close to the bone, and maybe distributing the load among a group of teeth. So, very often, teeth that a lot of dentists consider hopeless can be restored with Crown and Bridge, and that's the end of the bone loss. So, I have 70 years of documented evidence for what I teach. I have 70 years of cases where all the teeth were handled according to the same protocol. And so I can show x-rays 10, 20, 30, 40 years in the mouth, and with very few changes in the x-rays. Because I think the purpose of dentistry is to get rid of the patient's problem. And, there is a point at which dentistry might need to be remade. It depends on changes that occur, and everyone is different. So I do have patients with dentistry that I did in the mouth 40 years, and they got away with it because the changes are minimal and gradual. Whereas other patients, they had to replace the dentistry after 10 or 15 years to compensate for changes. But if the teeth are still there and you can remake the case, that's a success, because the object is to save your teeth. That's what patients go to dentists for, not to have implants. And except in certain circumstances, like congenitally missing lateral incisors, I think implants should be a last resort rather than a first resort. And what I'm seeing is what I call a piecemeal approach to dentistry, where you fill a hole or a space. That's a piecemeal approach, as opposed to an overall approach that looks at what's going on in the whole mouth and what can you do to prevent this patient from losing their teeth down the road. And the absolute signature of a piecemeal approach to dentistry is the single tooth implant. And the reason why I say that is, when you go to the lectures and you look at all the publications and you see the single tooth implants being placed, you don't see virginal teeth around them where there's no crowns or fillings or no bone loss. That is a perfect place for an implant. What you do see is the teeth have big fillings in them and crowns. And why would you stick something in the bone when you can do bridge work and solve the problem in the whole area? And So that's what I'm seeing. They don't know how to do crown and bridge, or how to differentiate what would be the better treatment option. So everyone gets the same thing. We have a lot of one trick ponies out there, and it's disastrous. And even worse is this thing called all on four, where they're extracting all the patient's teeth and they're putting four implants in, and then they screw a denture into the implants. And very often, this denture not only replaces missing teeth, but the missing gum and the missing bone. And it overloads the implants, which very often can't be placed that deep. And so you're going to have an engineering failure, because it's straight engineering. And all the experts say not to do this, because feats of engineering, the supports have to be able to support the bridge work. And it doesn't matter whether the supports are supporting a bridge across the river, or they're supporting a bridge in the mouth. The principles of engineering are quite clear. And there are really numerous examples of famous engineering disasters, because they didn't take into account the forces that were going to be acting on this bridge. And the same thing happens in the mouth, exactly the same. And they don't worry about what happens to the patient down the road and what's going to have the best chance of success. That bothers me, because there's a big emphasis on economics and workflow, and it should be health and longevity. That's what it should be. And implants are not panaceas, and you have to follow basic principles of engineering so that you don't overload them, because they could take perfectly, and then when you overload them, they're going to fail. And with this all on four, they flatten the ridges. So if one of those implant goes and the whole case fails, that patient can't even wear a denture because there's no ridge. So this is awful. And they're doing this on young people, and implants are not lifetime. I've had the patients where they only lasted 20 years. What's going to happen to that poor patient later on? That's something that nobody talks about, and I don't think that's right.
So you brought it up. You believe it's more economic, more the quick fix, the hey, they'll be back
Yes,
scenario. And let's be honest, a lot of people don't like going to different dentists. So once they find one, that's where they stay.
yes, and you hit the nail on the head. So one of the reasons why I'm doing this podcast is because people accept that if they go to a physician and they don't like what the physician had to say, they'll go get a second opinion. But they tend to do whatever their dentist says, and we're no different than they are. And so if like one person can't save your teeth, maybe another one can. And more likely, an old timer would have more knowledge and have better techniques for crown and bridge than the younger generation, even with all the fancy technology. Because let me tell you something about a lot of this technology. It violates basic principles. A lot of it does. Okay, and I'll give you a perfect example. They have a machine that can mill a crown out of a block of ceramic. And what these crowns are what you call butt joint restorations. That term comes from carpentry. So when you prepare a tooth for a crown or a bridge, typically you put a ledge on it. And this kind of crown goes right to the ledge. And the problem with that is that they can never be sealed. And a lot of them fall out because there's not good retention there either. And we made these crowns in the 1960s, except they were baked in an oven. It's the exact same thing. You think we didn't know what was wrong with them? So, what came from dentistry's roots, which is what my dad's teacher did, my dad did, and what I've done for my entire career, is to make the crowns on the model of the mason jar cover, which is the best known thing ever devised for food preservation. So, we didn't have crowns falling out. In fact, I let the patients wear the crowns and bridges on a trial basis with rubber or Vaseline, and they don't fall out. And also that we also don't have decay under our crowns because of the mason jar cover effect. Almost never, even in people who were susceptible to decay. The only time I really see decay is if changes occur and roots become exposed that weren't previously exposed. Those areas can become susceptible to decay. And these are very big statements to make, but this is what came from dentistry's roots. My dad's teacher did this. When you think about it, are we really advancing? And we're not. People want shortcuts. They want do things in a hurry, and that is not going to give the best results. You have to have diligent attention to details. Everything's in tenths of millimeters. You have to be careful not to overload the natural teeth. So if you can only take off 1.5 millimeters of tooth structure on a tooth that has a nerve in it, you don't want to put back more than that. So when you look and you see some of these Hollywood stars, they have a mouthful of teeth and they're overloading those roots, and a lot of them are going to have periodontal problems as a result. That's straight engineering.
So how do we change this? How do you get back into, having them educate these new dentists the right way?
Well, I just I just wrote my blog on this subject because the title of my blog for this month, which is on my website, is Fringified. Because people like me who are not affiliated with a university or a corporation are fringified. We are sent to the fringes of our profession and we are censored in a lot, not overt censorship, but prevented from speaking on academic stages and prevented from reaching the people who need to hear what we have to say. And I've seen that done to other colleagues who came up with fantastic things to help people. And this is rampant in medicine too. That you see what's
That's
going
why we're
on.
doing this.
Yeah, you see what's going on, and so you think we're really advancing? I mean, I really believe that anything new that comes down the pike must be compared to the standard that came before. Otherwise, we are not advancing. And as dentists, we are responsible for the outcome, not the means by which we arrived at that outcome. All the fancy technology in the world is worth nothing if it violates basic principles.
This is a cultural thing, though. I mean, if we look at a refrigerator, if it was built 70 years ago, it's still running. The ones that were built 10 years ago are not.
Yes,
It's the
and
same principle, though,
obsolescence.
with everything we're doing with medicine in general.
Yeah, people only care about what it looks like. And so when I'm a reviewer for the Journal of Oral Implantology, and I also go to a lot of lectures. I take a lot of continuing education as well as teaching courses. And I see very few people showing follow up. They show you how pretty the case looks on the day of insertion. What does that mean? Nothing. Because if it looks pretty but it doesn't hold up, is that something you should do? I don't think so. And I don't hear anyone talking about this. So I get these research papers. None of them show any follow up. How do you even know that worked? And I'm against this, and I'm very vocal about it, which doesn't make friends. But I don't care. You know, they want to get. They have an ulterior motive for printing their article, and they're more interested in that than the actual material. And some of it's not. I mean, not all of it's bad. But I'll give you another example. I reviewed an article recently, and it was on a special kind of sinus lift surgery, and that part of it was excellent. But the cases that they chose to illustrate it showed that they didn't even give a second thought as to how those implants were going to be restored and whether that restoration was going to work. So, what's the sense of going through all of that and then having the whole thing fail? I mean, I don't understand this. No one thinks.
No, I mean, it's a quick fixes. Like you
Yeah.
said, as long as it looks good, there you go.
Patients have no idea what they're getting. The things that we're judged on are meaningless. Like, oh, he has a pretty office, or oh, the staff is really nice, or oh, he gives a good injection. That has nothing to do with the quality of the work. Nothing.
So, so I know people that have had trouble with even placing dentures lately, and they're not holding or they're not staying in place. Is
Well,
that the
the
same concept that we're just being so quick with everything that they're
Well,
not
there's a
being made
place for
correctly?
dentures. The worst restoration in dentistry, the absolute worst, is the lower denture. Because of anatomy, the muscles of the tongue and the cheek lifted up, and dentistry does not know how to make a good lower denture. So that's the only time that I push people into doing implants, is if they have no lower teeth, because there is nothing else for those people. There was my there are some people who can tolerate anything. In fact, my dad always used to say that people are like horses. So you have, your thoroughbreds, and they have a very fine-tuned nervous system, and the least little thing sets them off, and you have to handle them with kid gloves. And then you have the horse that pulls the milk truck through the snow and the sleet and the ice and slush, and nothing bothers it. And people are like that. I've had both kinds of patients. So, the milk truck horse, they could wear a lower denture and be okay. And But most people can't, especially if they've had bone loss and they have no ridges. It's most of the time they end up not even wearing it. And that's not necessarily true with the upper, because you can get suction. And so most people can wear an upper denture. So actually, your lower teeth are more important than the upper teeth for that reason.
Well, and explain to people why having healthy teeth is so important in the beginning. I mean, it's a health and nutrition thing. It's getting the proper diet, isn't it? And your
Well,
teeth are
that's part of
extremely
it.
important to that.
But it's also important to understand that if you have unhealthy gums, That's a direct route for bacteria in your mouth to go into the bloodstream. And there is a correlation between systemic disease and heart disease with poor periodontal condition. So that's really another reason why it's important to have good oral hygiene and make sure you take care of all those areas that can really affect your overall health.
Well, and that starts with kids, doesn't it? We need to start teaching our kids to brush twice a
Yes,
day and floss
yes,
and do all the
exactly.
things they're supposed
And get
to.
get into the habit of having their teeth cleaned regularly, because when you're a kid, you can tolerate a lot of things that an adult is not going to be able to tolerate. As you get older, the body can tolerate less, and you're more likely to have problems and see problems as someone gets older. So it's important, if there's going to be problems, that you catch them early and do something about it. And one of the reasons why it's important to have orthodontics when you're young is because if the teeth are crowded or they're not in the right position, then you're going to have problems with wear or with periodontal bone loss, because the teeth can't take the forces in those directions, or it becomes impossible to keep crowded teeth clean. And that's why orthodontics is so important and much easier to accomplish when you're younger, when the bones haven't fully formed yet, than it is when you're older. But even when you're older, you can have orthodontics, and that will make it better very often.
When we talk about, okay, we've done everything right, it's going to happen. Something will happen. You're going to get a broken tooth. You're going to get a cavity. It probably will happen to everybody throughout their life. How do you find that right doctor? I know you say, you know, you can keep checking, but what if you don't know? That's part of the problem,
Well,
isn't it?
I don't know, because there are less people trained like me. There's only a handful that I know of who were trained like me. You know, my I had a genius for a teacher. He was a tough taskmaster. I learned everything from him, and most people don't have what I have. What bothers me is that today most younger practitioners, they don't want mentors. They feel like they know everything, and they know nothing. They know nothing, and they don't even know that they don't know anything, which is even scarier. And then the real victims are the patients, and there is no way they can really judge until maybe 5 years later whether their guy was any good. And that's a
And
sad
that's the hard
commentary.
Yeah, and that's the hard part. Here's the other side, the financial side, like we had been saying, it just continuously adds up. Because once you start down that road, it doesn't seem like it ends,
Well,
especially if you're with the wrong person.
dentistry's expensive. I don't use junk. They have some really crappy materials that everybody's using, something called zirconia, which came from nuclear power plants and belongs there. The best material ever devised for dentistry is gold. And then, if you're going to do crown and bridge, the best materials are combinations of precious metals. They have to be an alloy, because gold will melt at the temperature you need to bake the porcelain. And any one of those precious alloys is fine, but they're all not doing that. They're using this zirconia crap. They're only good for the butt joint restorations that I mentioned, and it's such a hard material that you could absolutely damage the teeth trying to get one of those things off. And everyone's using it because it's cheap and white, and I don't think that's right. I think it's wrong. And it's better if you have good dentistry and it's going to hold up for many years. Whatever you spent on that is a good investment. But if you have to replace it in 5 years, that's not such a good investment. That adds up to be a lot of money.
That sounds like one of the key questions to ask your dentist is how long is this going to work?
You know what my dad always used to answer with that? How long are you going to live? And it's impossible to predict. I always felt that if I didn't get at least 10 years, I thought it was a failure. And I would say the vast majority of my cases lasted over 10 years. And as I mentioned, I have cases in the mouth that I did in the mouth 30 and 40 years. And I know that that is a rarity. And a lot, it's all because of the way it was designed and basic engineering principles, and the use of proper use of materials and good materials. And it's hard now to find people who really know what they're doing. And that includes the dental laboratories, which that horrifies me. I still do a lot of my own laboratory work because they don't know what they're doing. And they're not interested in learning either.
Yeah, they're just there for the money, aren't they?
Yes, and that's the problem. That money and healthcare are not a good combination, and there's too much emphasis on money and workflow, and not enough on health and longevity. And this is wrong. This is going to give our profession a really bad reputation. And we once had a stellar reputation. Over the course of my career, I see the direction things are going in. And no matter how, it's like screaming into the wind. I mean, I can't get anybody to listen to me, but I know there are a lot of older practitioners like me who agree with me.
I think you brought up a great point. The leaders aren't the doctors anymore. They're business leaders, which changes the whole scenario. I was a medical helicopter pilot. I worked in the hospitals, and it seems like, and I mean, this goes back 15 years when they started putting the business people in. There was a huge change. There was a feeling of we don't really care anymore as long as we're making the money.
Yeah, that's right. That's horrifying to me. Is that all you're about? I mean, how do they sleep at night? I couldn't sleep at night. I couldn't do that. And I think you could still make a good living. I mean, um, do what's right for the patient, and take your time and do things right. I
I
don't,
agree.
my dad, when he started in practice, he said, I want to be the best dentist. And he made that happen. He had an amazing teacher also. And I'm a product of that. But I don't hear anybody saying, I want to be the best. I hear a lot of people saying, I want to make a lot of money, and I want to be successful. And they mean financially successful. But I don't hear anybody talking like they used to. That's scary to me too.
Right. Well, and like you brought up, how do you prove it? You do follow ups, and they're not even doing the follow up.
I never see. I go to the presentations almost never, and I don't see any in these articles that I'm reviewing. I reviewed 87 papers for the Journal of Oral Implantology. I don't think one single one had follow up at all. You might get some finished X-rays. I make a big deal about that because half of them don't even provide finished X-rays, and I make them put it in the article. But what about 5 years later? How do you know this even worked? I mean, this is ridiculous. This is not right. But one of the problems is that a lot of the motives and the reasons why the articles were written, like a lot of these papers come from Europe, where you have to be published in order to get your doctorate. Bad idea, because they're not around long enough in their degree program to do follow up. So these articles are worth nothing. The only good articles are like retrospectives of what's already in the literature. Those can be really good articles.
That's interesting, though, that you brought up. They have to write a paper. Or, yeah, I never knew that. Yeah,
Yeah,
completely
and then
changes my thought on the whole thing.
everybody says, "Oh, academics and all the statistics," which is BS. Those statistics mean nothing, and I'm starting to see a lot of science going away from this statistical analysis because there are a lot of things wrong with it. The whole thing ideas are flawed, and making out like academic research with these double blind studies is better than clinical observation, because I could show case after case after case after case where all the cases were designed with the same protocol. And when you look at my X-rays, you could see it looks like the margins of the crowns are sitting right on the bone, which is the best architecture that you could have to balance the forces on the supporting structures, which is the bone and the roots. No, you have to go far and wide to find other dentists who could show you that, because that is not what you see when you look at other people's X-rays. And every single one of mine are like that, and
Something
my dad's teacher.
right. Well, and I think the attitude, and it's not of all of them. We know it's not all of them, but there's no empathy there for the patient. It's a 10-minute cleaning and out the door unless you need major work.
Yeah, that's not fair or right. They should set aside except for maybe kids, which don't require very much treatment, most of them, at least an hour to do it right, and take your time and do it right. And like I always work closely with my hygienist um, from New York. I'm still in contact with my hygienist who I had in New York. She loves me, I love her, but um, you know. They need to do a good job. If they can't do it all in one visit, bring them back and continue. And that's what we always did. I only cared that it was done properly. There is some really cool technology that I saw which would help hygienists a lot. And there's somebody here in Arizona who's using this. And this is a camera that's a millimeter in size. And
Wow.
the camera can go under the gingiva and see everything. So previously, you'd have to flap open the tissue in order to clean and make sure you got all the calculus under the gum off. But now you could see it plain as day on the screen, and the hygienists are doing all of this. And I saw it demonstrated, and it was is really fantastic. So it sounded like I'm against technology. No, I'm against technology that goes against what I believe in, but technology that conforms to what I believe in is great technology. And that's a perfect example.
It's basic. You believe in helping the patient. It's that easy.
Yeah.
That's the main principle of being a doctor is just simply helping the patient.
Yeah. Well, in all fairness, a lot of them really think that they are doing the right thing. I don't think anybody sets out to do the wrong thing. That's all they know. And they don't know any different. If they don't know how to save teeth, they're going to be extracting them. So I can save teeth that are flush with the gum, and I don't build them up, and I don't put posts in, and I don't do fancy orthodontic procedures or any of that, because most dentists are trained to hang their crowns off of whatever's sticking up above the gum. And if they don't have any tooth structure sticking up above the gum, they don't know how to do it. Sometimes they build them up. That doesn't work very well. Whereas I don't care. I care about what's below. So I don't think those teeth are different than any other teeth. And I know how to make temporaries with copper bands so that they don't fall out on those teeth. So that's like falling off a log for me to save those teeth. And yet most of the profession, they look at that and they don't know how to do it. And right away they want to extract it and put implants in because that's all they know how to do. This is not fair. And this is not what you would want for yourself. And I don't know how you reach people. I don't. If I really have all this knowledge and ability to train people, but as I pointed out in my blog that I wrote for this month, you have to be able to empty your mind of preconceived ideas in order to absorb a completely different philosophical approach. And I think that dentists aren't taught how to do that. They are not taught critical thinking skills. They are not taught when is it appropriate to do this type of treatment or that type of treatment, or to have enough options for patients who are candidates for sophisticated dentistry and patients who are not candidates for sophisticated dentistry. So I have options for both. And as you mentioned, my whole idea is to help people, and not everybody's a good candidate for crown and bridge, but they should have something. I never let anybody walk around with no teeth because that affects your whole personality and you can't navigate. Most people become very self-conscious or withdrawn, and it affects their whole social life. When you help them out and they have teeth, they can navigate socially and they feel much better about themselves, and that's very important.
Well, and here's the other problem I see is the patient themselves, they wait so long. They wait until the pain is excruciating and they need something done now. So they don't even give themselves the time to say, okay, yeah, this is not the way I want to go because they've waited so long. So, how do we get those patients,
Well,
the people to start paying attention to themselves and get them in quicker?
in all fairness to those people, a lot of them have been traumatized or they're very afraid you first, when you get one of those patients, you first have to make a patient out of them. You have to handle them with kid gloves. You can't make them feel bad. Whatever happens, happened. You can't undo what happened. You can only go forwards. And you have to make sure that they don't feel anything, that you're never going to hurt them. So if you were in the middle of a procedure and they feel it, you stop. Even if they say it's okay, it's not okay. They are never going to forget that. And some have been hurt and they're traumatized and they don't want to go back. And you can't blame them. It's understandable. I try to handle those people with kid gloves and make a patient out of them. I want them to, I don't want it to be a bad experience or a chore that they have to come to the dentist. And I want to make sure that they leave with temporaries that don't fall out, that they have to worry about. That's important. I spend a lot of time with the temporary restorations because um, also you have to have the patient on your side, and if they having problems with their temporaries, and now you go and put the permanent case in, no matter how beautiful it is, in their mind, it's a failure because look what I had to go through. And that's very important. And you have to minimize what they had to go through and make sure they're comfortable in between. And then you can do whatever you want and take as long as you want, as long as they're comfortable and happy. And that's what I always strive for. So I would spend a lot of time. Plus, also too, the temporary restorations were my blueprint. I knew exactly how I was going to make the permanent. I didn't guess or have anything dictated by a laboratory as to how the dentistry was going to be made or designed. I knew they were comfortable before I made anything, and then it was simple to make the permanent restorations on that model. So I think that's important, and not enough people. They don't even know how to do anything anymore. When I first started in practice, I would spend hours carving teeth. That's all I did. And when I started working with my dad, I was carving teeth all day long, and they don't know how to do that now. All the schools, they get all this fancy digital equipment from the manufacturers, who of course want the students to buy this stuff, and they don't know how to do anything. So what if they go on their residency programs and they don't have any of this equipment? What are they going to do? They are not prepared. See, I think it's important to have good analog skills, and then that will transfer over to digital. But it doesn't work the other way around.
Know
And
the basics.
they know the basics exactly, and you have
You
to be
see
able to
that in
do it.
all medical right now, whether it's a nurse or a new doctor, they're not teaching the basics anymore.
They're
They
not.
they they
They're not.
skip it, and it's sad for the patients. It really is because they don't know how to take care of them. It's on a basic level.
It's true. And as I mentioned, all this digital stuff, these are tools and they're not ends in themselves. And they're treating technology as like it's the be all and ultimate and all by itself. And then I think one day AI is going to do everything. In fact, if you really want to be scared, this company, this company in Connecticut invented a robot, and some poor soul from the UK sat for this thing that prepared a tooth on a patient, and made the crown, like I said, out of the block of ceramic, and cemented it in without a human being. And then the president of this company was saying, "Oh, he could do it so much. This machine could do it so much faster than a human being, and it was so much better." And all it's crappy dentistry, and that's the truth. And yet, people are going to buy all of this stuff because it's AI and it came out of a computer.
There's no feelings involved. There's no, again, empathy involved. There's
Yes, well,
no
that is one of the wrong things that's wrong with AI and why we can never be really replaced. And in fact, who was it who was it was I think it was Richard Feynman, who was way ahead of his time, and some of the things he like foresaw about AI. And he said that the people who have the skills for empathy and critical thinking, because I just saw this video on him. It was fascinating on how his father brought him up to be a critical thinker. And that's how he became a Nobel Prize winner, because he was trained to see patterns and to think, whereas most of them, are trained to spit back and memorize and spit back and don't have that's what's wrong with our educational system. And that was fascinating video. It was on Facebook, and it was just fascinating. I'm a huge fan of his because I believe critical thinking is so important in my field, and I don't see many people with good critical thinking skills.
No, and we call it common sense, don't we? But, that's part of why I'm doing this is I don't feel like people, or I'll just say myself, I sit there and I don't feel like people are asking the right questions. And
Right,
that's
and
why I'm kind of doing this.
that's
And that's to
exactly
me
what
the
Richard
common
Feynman
sense.
said. That's
Yeah.
exactly what he said.
It's it's true though.
It is
And that's
true.
even for those patients going in talking to the doctors, they don't know the right questions or they're scared to ask the question. And it's
A lot of them get scared in the chair. So, I always talk to them out of the chair because, it's not easy sitting in that chair and you could just agree to everything or be scared and not hear anything. And that's common. You explain things to a patient, they didn't hear one word you said because they were so uptight and scared that they weren't really listening. And that's a hard thing, really. So I want them to feel comfortable, and I really feel patients should never be pushed into treatment because one of the choices they have is to do nothing. And no, and they should be sure that this is something that they really want to do before they'd agree to it. Because I'm seeing patients being pushed into overly invasive treatments, and you have to ask yourself, is this really appropriate, or are there some better ways to do things? And especially with this all on four, that is the worst thing I have ever seen. And everyone accepts it and they just accept it. And it's the easy way out because if you're going to do implants, they should be treated more like teeth than like dentures. And they should be put in the right places so that you can make real teeth out of them and not have this screw in a denture idea. They can't even clean under it. And that's supposed to be good. That's not good principles of health, where the only way you could really clean it is to unscrew it. How you can't? That's not reasonable, and it isn't. But this is what they're doing because it's easier, and they could put something in 2 visits, and then they don't care what happens to the patient.
yeah, it's sad. It really is. But that again, that's why we're doing this is to get it out there. Be careful. Really ask those questions. Really understand what you're getting yourself into because in the long run, it's extremely important to your overall health.
Absolutely, and I worry about what's going to happen to some of these people when some of those cases fail and they're not able to have any more implants. What's going to happen to them? And they're doing some way out things like zygomatic implants on some of those people. And now you're on the slippery slope. You really don't know if that's going to work or not. And
Well, and we hope that from an education standpoint, from other doctors that are watching, just let's go back to basics again. Remember who
prevention's
you're working
everything.
with.
That
Remember who
everybody
you're
should
working with, and that's the most important thing is that patient. So just
absolutely. And a good yardstick is if you had what the patient had, would you want that for yourself? Would you do this on your loved one or your relative or somebody you care about? That is a very good yardstick. And if the answer is no, you shouldn't do it for a stranger either.
very true. I love that. That's where we're going to end it right there with that because that is so true. All right. Dr. Edward Feinberg, it was an absolute pleasure. There's so many things that need to be taught and learned from so many standpoints. And it was a pleasure to have you on and explain your side from the dentist side. I really do appreciate it.
Thank you. Thank you for having me. One of the reasons why I like to do these interviews is I really do feel strongly that people should know and they should think and ask questions, just like you said. And I think a lot of people are not aware about some of the things that are going on. And I want them to be aware and make sure that they're doing the best they can for themselves.
Well said. And I'm going to post a blog will go along with this, and we'll get Dr. Feinberg's all his information on there so you guys can easily reach him. And yeah, again, thank you so much. I appreciate it.
Thank you very much. It was a pleasure.
Yes. And for all of you, remember, Find the attitude, keep the attitude, go out living. Until next time. Bye, guys.